Hello everyone, this is NainaMD, Beverly Hills, Fusion of Science and Beauty. Welcome to my show. And as you know, my passion is all about anti-aging and regenerative medicine, spreading the knowledge. Today's show, I want to focus on integrative laboratory testing. In other words, when your doctor tells you that all the test results are normal and you're still feeling the way you do, I want to expose you to what else you could possibly have done and what other information is out there. So today's guest is Elaine Woodward. She has been a clinical educator for over 8 years, and she's fabulous. And she is now representing a company called Neuroscience. Now, I knew Neuroscience back when Dr. Kellerman, who actually founded Neuroscience, and he used to do lectures on what we call neurotransmitter testing. And this is testing on, for example, neurotransmitter testing is these neurotransmitters in our brain. And a lot of times we can actually test for some of them. So he initiated that. The lab has grown into much more extensive testing. And today's show, I want to focus on Lyme disease. Welcome, Elaine.
Thank you so much. Thank you, Dr. Naina,
well,
for having me.
You know, the reason I wanted to really focus on Lyme disease is that so many times there's symptoms that are going on, okay? And the client or the patient goes to the doctor, and the test results are negative, right? And they wonder why are they still feeling the way they are, and what else they can possibly do. And then it gets into from there it can get all kind of muddled, because you know, they may go see a naturopath, or they may go see another doctor, and then they may go see another Ayurvedic person, or they may go see an acupuncturist, because they don't know what to do. But they do know that they're not feeling right, that something is still wrong, right? Yeah. So one of the things in integrative medicine, and this has been very evidence-based, we learned, is that you can do further testing. So a lot of the times the routine testing, right, is just doesn't tell it all. Yeah. And so a lot of times, even if, for example, in Lyme disease, right, if we have a patient who has, as you know, some of the typical Lyme disease symptoms are still feeling really tired to the point of exhaustion, they're having body aches, joint pains, they could be having this rash. Sometimes they call this like this kind of a rash that appears like a, it almost looks like a claw rash. But there's another rash that starts, of course, when the tick bite is, of course, there. But there's so many symptoms, but fatigue is a big part of it. And they go to the doctor and they do the test and it's negative, right? And so they see other doctors, and one of the tests is also known as the IGNX test. That they can, that they often do. And so based on that, they actually find out that they do have Lyme disease, and then the treatment starts. And there's a host of alternative treatment regimens where the belief is that we need to detoxify you. So a lot of times the detoxification treatments, chelation treatments may be started. Sometimes they discover that, we need to treat with more antibiotics. So I've seen anywhere from multiple antibiotic regimens, at a time. That leads to other issues, which the disturbance of the gut bacteria, so then they're into, another whole host of issues. So I guess it's a very complicated situation. A lot more people we're finding out are having more diagnosis of Lyme disease. And I just want you to tell the audience, first of all, your work for Neuroscience, right? And like I said, I know Dr. Kellerman, but by the way, say hello to him and thank him for having you be able to come on our show. Yeah. But I want you to just first explain why the need for alternative testing, besides just the patient not feeling good. How do you guys arrive at that? How did you arrive at this alternative testing? And then tell about the accreditation, because a lot of people say, well, this alternative testing is junk. It's like it doesn't have any science to it. So I think that's really what I want you to kind of talk to the audience about alternative-based testing, and then we'll get more into the Lyme disease testing. Okay?
Yeah, absolutely. Well, I have just a high belief in Dr. Kellerman. He's been just such a great example for what research and development on the cutting edge looks like. So
Exactly.
in terms of alternative testing, he has a PhD in biochemistry. My background's in biochemistry as well, so we relate in that sense. But looking at things on a molecular level, so giving practitioners the tools and the right tools is the most important thing to be able to diagnose patients correctly. So as you were mentioning before, a lot of patients that are doing some routine testing from their primary care practitioners are getting all the results are coming up within range, and they're just walking around going from doctor to doctor trying to figure out what's going on.
Exactly.
And that's where neuroscience comes in. We do the neurotransmitter testing like you mentioned. We also do genetic testing. We do hormonal testing.
What are some of the genetic testing you do?
Some of the genetic testing we do is methylation testing,
yes.
so looking at COMT and MTHFR.
So let me just explain that. That's why I brought it up. Okay, so we can't test every gene, right? There's like you can test for every gene, but sometimes you wonder, okay, let's just say we test for every gene. Then so what? So what happens when we do? You've got this and you've got this gene mutation, this gene mutation. But the empowering thing is of certain gene testing is that you actually can do something about it. For example, the 5-MTHFR, right? So it's called 5-methyl-tetrahydrofolic acid reductase. And this enzyme, if it's reduced, meaning if you've got a mutation where you're not able to have the reduced activity of this enzyme, that means you won't be able to break down your folic acid into what we utilize, which is 5-methyl-tetrahydrofolic acid, right? And so there's different breakdown products of folic acid, and this is what is utilized. And if we can't do it, that could lead us to maybe depression, higher rates of depression, maybe a higher risk of heart disease, maybe a higher risk of various illnesses. All right. So now, having said that, a lot of the conventional thought was, okay, you can't do anything about it anyway, so why test? Well, you actually can, because with this thing, you can actually give the breakdown product of folic acid. So you wouldn't want to give that person just folic acid because they can't break it down. And in fact, when they cannot break it down and you give too much of folic acid, it can oxidize. And if that's when sometimes conventional medicine says, wait, it could feed a cancer because, of the folic acid buildup, it can just become an oxidant. So it is very empowering to know that through certain genetic testing, which are some of these common, what we call SNPs or single nucleotide polymorphisms, that these mutations we can test for, but then say, here's a nutrient that can upregulate, downregulate, and this is my field, which is nutrigenomics, which is what I've done for the last now 15 years. I no longer, really practice conventional medicine. I practice integrative medicine, and this is part of it. So having said that, that's why I look to you guys to be able to say this is amazing, and then there's certain ways that you even test for these mutations. There's like entire DNA. You look at the full DNA, or you look at just the axon to axon. So there's certain methodology, and their methodology is really good at how they do it. So so just to say that's very empowering, about the genetic testing that you guys do. Okay, so you were going to say what else testing?
Again,
the oxidative stress.
The oxidative stress. We also do detoxification genetic testing as well, which is really big with practitioners focusing on detoxifying their patients. So looking at the glutathione gene and seeing how well that functions. And as you know, with the pollution that we're exposed to on a daily basis, the foods that we eat or may not
all the environmental toxins, right?
Yes, that can cause problems and issues with those that have a SNP in that gene. So we want to look at that to see how we can better optimize their genetics. To be able to detoxify better and to be able for them to just live healthier lives. And
which is a really big part of even the Lyme disease, situation. So what is it, just again for the benefit, I know I introduced you as saying you're neuroscience and laboratory testing, but really explain more in detail what neuroscience is.
Neuroscience and Pharmason Labs, we're just a nutritional testing company. So we do both the diagnostic testing for patients, and again providing the neurotransmitter testing. We do genetic testing. We do more Lyme disease testing as well as hormonal testing, and then we offer just a personalized, customized plan for those patients by giving them the supplements that they need. So neuroscience actually provides those supplements, so that the practitioner does not have to go elsewhere to try to to figure out, okay, what kind of milligram dosage that they need from another company. We provide all that for them, and that's from the 25 years that neuroscience has been around. Dr. Kellerman has really just optimized the patient results that we've gained from over the years and seen what supplements work best for those patients. So we can really move the needle in terms of either their neurotransmitters or helping them get better with our supplements as well. So it's a good approach. We do both the testing as well as the product.
That's really good. So having said that, let's focus a little bit more on Lyme disease, right? That's really what the whole idea is. Have you, just as a clinical educator, have you like you've talked about Lyme disease, okay? From your viewpoint, just from a very simplified, what do you when somebody tells you about Lyme disease, what do you envision and what do you think about?
I come across a lot of doctors in the field that have seen patients that have either even traveled from across the U.S., so been on vacations and come back with Lyme disease. And just with all the issues that they've dealt with, those symptoms that you had mentioned before, flu-like symptoms, fibromyalgia, migraines, they could have dealt with them for either weeks or even years. And so just right away, just to answer your question, I just immediately feel a lot of compassion for those patients and those doctors that are dealing with those patients, because those doctors are really looking for a test that will accurately diagnose them well. And so when patients are coming to those doctors looking for relief from their symptoms or looking for a diagnosis because they've been to so many other practitioners and haven't gotten the results that they've needed, and now coming to a doctor where they're looking for that information, I'm really happy to just let them know that we have the right tool for them with the iSpot Lyme test. So this is just a different type of test where we're looking at the T cells rather than looking at the B cells, which is really common for those practitioners. For years and years and years, all practitioners have been taught by the CDC to do it's called a two-tiered approach. So doing an ELISA test, which is only about 30% accurate.
Exactly. That's really, it's the ELISA test, which I would say the bulk of the people rely on, right?
Exactly.
And ELISA test, it's just the method, okay? It's just the method by which you obtain the result, okay? So every lab processes things differently, right? So if you do a Lyme test, they use in the laboratory, it's called the ELISA method, but that's, like you said, only 30%.
So I mean, again, these patients that actually have Lyme disease are coming back with negative results, and so they think that, hey, what's going on if that's coming up negative? So then the second step that usually practitioners will do is called a Western blot test, and that's the B cell test. And that even said, it's only 50% sensitive and specific for that test. So again, it's not that high either.
Right. So it could be that if those 30% of the people, first of all, let's say if the ELISA test comes back positive, then you know that person has it. But let's say it comes back negative, which is chances are it's going to come back negative because it's only 30% sensitive. So now you've gone to the Western blot, okay? Now let's say they test negative for that. So now, again, the doctor will say, well, look, your test has come negative. We did now the ELISA test. We've done the Western blot test. It's still negative. But the patient is still feeling all these symptoms. And I've personally in the past, okay, when I've had patients come to me. So in the past, I had a client that actually tested negative, and they were actually told that they were depressed and that they should go on antidepressant. So they actually came on an antidepressant. And by the time we got through, and as we go through this treatment, the testing process, as we found that this patient did have the Lyme disease and and effectively treated and so forth, then they got off their antidepressants. So it's so much of it is all to do with their tools, right? And that's what I love about the company, and that's really why I wanted you guys to come on the show. Before we go into break, just wanted, again, if you could tell the audience the website. Is it Neuroscience
they can go to pharmasonlabs.com, or they can go to specifically for Lyme disease.
Just for like just if you want to just know about the lab.
I would go to pharmasonlabs.com.
Okay, so it's pharmasonlabs.com.
Yes.
Right?
Yeah.
Okay, and what if it's specifically for Lyme disease? Where would they go?
And that's going to be iSpotLyme.com.
Okay, so we're going to talk about iSpotLyme.com right after this break. Hello everyone, welcome back to my show, NainaMD Beverly Hills, Fusion of Science and Beauty. And as you know, is talking about some of the alternative ways of Lyme testing and how you can actually, when you test negative, there might still be certain tests you can do that would still be able to ascertain that you've actually got Lyme disease. And one of the revolutionary companies that I consider, and I've known them for a long, long time, they've been Neuroscience. And they're also now coming under, they've collaborated with Pharmason Labs. And just to correct, the website is pharmason.com. Correct, Elaine?
Yep.
Okay. So Elaine's been my guest. She's from Neuroscience Clinical Educator, and she's been with them for some time now. And we were just talking about the Lyme disease testing, right? Mm-hmm. So let's move. So you were talking about how these patients are still having these symptoms, mm-hmm. these doctors, and it's so frustrating that, you know, that they're still testing negative. Mm-hmm. So then the next test, which is very common among the integrative doctors, is the IGeneX test, okay? Mm-hmm. Can you explain a little bit about what you know of that?
Yeah, IGeneX basically does a Western blot test. So they're looking at the IgM and IgG antibodies for Lyme disease or Borrelia burgdorferi. So what happens is when you're only looking at the B cells, if someone has been infected, for example, those B cells can be raised and could be up high for a very long period of time. So it does have a high tendency, again, what I had mentioned before, Western blot is only 50% specific and sensitive.
Right, so what you're getting at is that, number one, if they test negative, mm-hmm. it means that they could still be positive. But if they test positive, mm-hmm. then you still don't know if they've got an active, right? Yeah. That they've got an active, that they've been or that they could have just been infected in the past, and now the titers could have come down, right? Mm-hmm. Technically,
correct.
And so you really don't know what really where they're at mm-hmm. in terms of their Lyme disease active disease state.
And that's why I like the iSpot Lyme test.
So let's talk. This is what I really wanted to educate everyone about, is that there is another test, and I think that's revolutionary because I didn't have these tools until recently, and until I learned about the iSpot Lyme, and that's why I was so eager to have you come on the show, mm-hmm. is because I want you to talk about what is this now iSpot Lyme test.
Mm-hmm. So the iSpot Lyme test.
It's iSpot Lyme, okay? Mm-hmm. It's like ISPOTLYME. So it's the iSpot Lyme test, yeah?
Yep, that's correct.
Mm-hmm.
So it's a T-cell test. So it's a totally different technology than what is out there. Again, comparing it to the common B-cell test. So mm-hmm. what we do is we actually...
And T and B cells, just for you guys, it's just a assessment of your immune status. You have T cells and your B cells. So mm-hmm. this one actually tests for the T cells, which mm-hmm. you were mentioning, huh?
Yeah, so with the test, we're actually looking at interferon gamma secretion from the cells.
So in other words, how much so when you've been infected, are you secreting enough interferon for your immunity, right? To fight,
correct.
Right,
yeah.
to fight the virus, so to speak.
Mm-hmm. So that's what we do with our test, is we stimulate those cells with what's called 4 antigens from Lyme disease or Borrelia, and there's 2 earlier stages of antigens, there's 1 acute stage of antigen, and then there's a final, the 4th one is a later stage of antigen. So we're attacking all areas of where that patient could be having Lyme disease. Mm-hmm. And when we see interferon gamma secretion, we actually see spots form, and that's why we call it the iSpot test.
Because it'll tell you then at that particular stage mm-hmm. where that patient is, right?
Correct. So the more spots they have, the higher the likelihood that they are positive for Borrelia. Again, the 2 things that our test is able to do is, number 1, we're able to detect for Lyme disease a lot earlier than all the other methods that are out there. So within 2 weeks, T cells can develop.
Yeah, because T cells develop right.
They develop right away.
And then that's when the memory and all of that, then they get the B cells, and right.
Yeah, and that could take 4 to 6.
That could take 4 to 6 weeks. So so if you've actively been having, let's say you thought you got bit, and you think it's an acute thing, you could miss a window period of about almost 4 weeks, right? 4 to 6 weeks.
Even 8 weeks.
Before you can even go and get a test. And this one would pick it up within, 2 weeks.
Yeah.
This is amazing.
It's the fastest test out
because
there.
sometimes, even though they say the rash, a lot of people miss that.
Correct, yep.
A lot of people don't really recognize that there was this you know, the book showed so beautifully this rash. I mean, how, like, you figure, okay, how could you miss a diagnosis of like Lyme disease because of rashes? But no, it doesn't work that way.
Exactly. I mean, you could be out hiking out in the hills of Malibu even, and there's ticks out there, and not know that you've gotten bit and not even develop a rash.
Yeah, exactly.
So,
and more people aren't developing, or they don't necessarily develop or have a rash.
Exactly. Yeah.
So this, okay, so that's one thing. It would pick up in acute. Now, what I want to really get into more is this, that, so let's get into also the usefulness of when you have a person, okay, let's say you go see an alternative, an integrative doctor, okay, and you go to all these clinics for Lyme disease, right? And then they tell you, well, wait a minute, you've got Lyme disease. I want the audience to be smart enough to say, well, which stage?
Yeah.
And so most of them, if you're just doing the IGNX test, you can't tell. And so how do you know that if you've been just infected in the past that all your symptoms are just really just still due to Lyme disease, right? Because now the titer, the activity could be less.
Yeah.
So you still don't know that. And so this one now, if we did this eye spot Lyme, right, then this might pick up the later activity, right? So if it was like, if it was elevated at a later stage, right, then that would mean that they could have it at that point.
So another thing to mention too with our test is that we're actually able to see how active their immune system is. So say, for example, a patient has been infected, they got infected about 20, even 25 years ago, even 10 or 15 years ago. Over time, the immune system
keeps working,
but it starts to slow down, so it's not able to even develop a response anymore for the B cells. So what our test will do is that we actually do an unstimulated response, which is our control, and then we do a stimulated response.
Okay.
When we do a stimulated response, we're able to see how well the immune system is actually functioning. And so if they are coming up low, that means that they aren't able to develop those antibodies, and so that patient may have been getting those false negatives. Meaning that their immune system over time is so trashed, it's so
but does the unstimulated one show that they have it, right?
That should just come up normal. That's just used as a control for us.
Got it. Okay.
And then the stimulated response is what we want to compare it to. So we stimulate those cells with PHA and see if there's a response, and if it's elevated, then that's great. Their immune system is working optimally. If it's coming up below, which again the doctor can see on the report, that means that, okay, this is why your IGNX test or Western blot test came up negative when you really should be positive. So we look at 3 different areas. Both, number one, if they
is the early detection, right? Early detection within a 2, right? And number 2, if their immune system is like so low, right, that the immune test for the immune function, right? Okay. And then the third?
And then the third is actually testing positive or negative for Lyme disease. So regardless of how the immune system is functioning, that's another benefit with the test. The T cells will be up if that patient has active Lyme disease.
Okay.
Whereas with a Western blot test...
So in other words, if let's say they test positive and the T cells are up, that's when you do the stimulated? Is that when you do the stimulated test?
We always do it on every single test, so just to show the doctor.
So that's just an extra. So that's just an extra sort of result, which is great to have. So when you see it elevated, you simply go and say, okay, here's a stimulated, but the stimulated is showing down. So here they have it, but their immune system is showing that they don't have it, so it's low. So see, this is the I'm not asking you guys to become scientists, but I needed you to tell you this, explain it, because this Lyme disease is it seems to be on the rise. Okay. Or maybe we just now know more about it. And that's what we're saying that. But a lot of people are having symptoms that are like very typically, like you said, flu-like, mitochondrial-like. They have all this mitochondrial dysfunction, which means they're fibromyalgia-like symptoms. You know, I always talk it in biochemistry, mitochondrial dysfunction, but it's really like fibromyalgia, muscle aches, you know, joint pains, just all the time tired, brain fog. Sometimes they've got a lot of gut issues. I mean, there's just multiple things, and they go get tested, and there's usually everything's normal.
And that's again, their immune system is so trashed over time that they're not able to even develop a response to show positive on that test. Or again, the doctor could be testing too far in advance, where again, it takes that 6 to 8 weeks for those antibodies to come up. A third reason actually where a patient could be getting a false negative result is where, so when you are bitten by a tick, a spirochete is inserted into the body. It can actually, what it does, it burrows into the tissues. And so again, when you're testing the blood for B cells, it's not going to find it. Even a PCR test is not going to be able to find that Lyme disease because it burrows inside the tissues. Where again, T cells, we look at the peripherals. So we're able to detect universally in the body if a patient does have active Lyme disease or not. Where again, it's so, with the B cell test, it's so dependent on if that, which most likely it is, the spirochete is burrowed inside the cells.
Yeah.
So that's why these patients I feel so bad for, because they are getting these false negatives from just wrong testing.
Well, I also feel bad for a lot of the patients who are actually having they're positive by the IGeneX, and yet their activity may not be elevated, but yet they still get treated by 6 antibiotic regimens, and you still don't know how active. So you still don't know if, like, meaning 100% of that, their symptoms is coming from that. Subjecting a person to 6 antibiotics, sometimes, or multi, antibiotic regimens is a serious thing nowadays. Before, in my time, it never was. I mean, you could just give, antibiotics after antibiotics, and it was no big deal. It was like giving it like candy. Now we're realizing the disruption of the gut system. We're realizing that 60% of the immune system is in the gut, and so forth. So these things are very, very important.
Yep, absolutely.
And so I think that it's so important to have talked about this. Is, you guys, I'm just going to flash up again. This is like, this is the look at them. It's pharmason.com. They'll talk about the eye spot Lyme right here. And then this is the, if you're testing for Lyme disease with only Western blot, you're missing half the equation. This is also on the website, but it's a great discussion on that. And
to mention also, so our test in terms of our sensitivity is 84%, our specificity is 94%. Again, so much higher than the 30 and 50% that we had discussed from the other methods.
I mean, there's like no reason not to do this. Okay, I hope you guys learned a lot. It was a little lesson in science as well, but I'm so glad for you that came on the show. What's the website again?
So for the Lyme disease test, it's ispotlyme.com, and then for our general neuroscience and pharmason lab testing, it's pharmason.com.
Okay, and what about for the supplements?
And supplements is going to be neuroscienceinc.com.
Okay.
And that's going to be all our neuroscience supplements.
Sounds great. Thank you once again for coming on the show.
Dr. Naina.
I hope you guys learned a lot. This is NainaMD, Beverly Hills, Fusion of Science and Beauty. We'll be back next week with another great show.